We are live.
We're live. Senate Appropriations. We're going to fiscal year 27 budget requests. And today we have Dale with us. We have the commissioner with us. So you can introduce yourself and anybody else you want to that you have with you, and then give us your presentation.
Thank you.
I'm just going to pass it. We printed out a couple pages of your presentation, so we thought it would be easier for the committee to have hard copies of this part.
Yeah, I know. I see what they printed out. We printed out before.
No, thanks. Sure. Oh, you want that?
Oh, I don't just so I know exactly what you're gonna.
You get another one?
I have another copy.
Okay.
Okay.
Sorry for that interruption.
Okay, I'm Dr. Jill Bowen, Commissioner for the Department of Disabilities, Aging and Independent Living, Dale. And with me,
Angela Smith-Jane, Deputy Commissioner.
Bill Kelly, Financial Director.
And Nancy Gardian, the Development of Disabilities Division. Angela McMahon, the Adult Services Division Director.
okay, thank you. So we're gonna start, you're gonna, Rebecca, you didn't introduce yourself.
Oh. On the record, Rebecca Silvernagle, Principal Assistant at Dale.
Okay, thank you. We're going to walk through some key points of the testimony. So you're gonna put it up there and we're just gonna talk to certain key areas that we would like to highlight. Okay, so page 4, number 1. So we want to highlight for you, for those who are not familiar with Dale, and I don't know if that's the case for anybody in the room right now, but we just want to just let you know that Dale's 5 divisions are the Adult Services Division with a focus on older Vermonters, the Division for the Blind and Visually Impaired, the Developmental Disability Services Division, which includes the Office of the Public Guardian, the Division of Licensing and Protection, which includes survey and certification, and the Adult Protective Services, and the Division of Vocational Rehabilitation, which is higher ability. Then there's the Commissioner's Office. So the first point we want to highlight in terms of the work that's ongoing is Age Strong Vermont Plan. For those who don't know, it's a comprehensive 10-year multi-sector plan on aging. We are the second fastest growing demographic in the nation, with a third of our population over 60, and it's growing steadily. This is a very thoughtful approach that is one of only a few multi-sector plans on aging in the country. There are other states that are working to address a growing demographic as we are, but not all of them have such a comprehensive plan, strategy, and approach. We have just completed year 2. 2025 was year 2, and our year 2 report will be out within the next few days. We really recommend you to take a look and to see what's going on with Age Strong Vermont. Page 4, number 2 is to highlight the conflict-free case management, developmental disabilities payment reform. That is a plan that was required by the federal rules from CMS that has been in place for some time, but Vermont was virtually the last state to come into compliance. We did have a settlement agreement, and we went live with conflict-free case management and payment reform October 1st of 2025. That was many years in the making, but it is a complex approach that takes some time to adjust to. We've been working with our partners to work through those challenges. Next is page 5, number 3, to highlight supportive housing for developmental disabilities. Last session, 69 did put a commission together, a committee. The Road to Home was the report. It was a multi-stakeholder effort. There is a tremendous need for housing for folks with developmental disabilities. The system that's in place now is insufficient to meet all of the needs of those with developmental disabilities. Many who are with families that are aging. Here comes the intersection between developmental disabilities and an aging demographic. This just highlights some of the work we have done to date and were able to accomplish last year. And it shows that we have stood up for help to stand up with our partners. Haynes-Bass, which was a housing project that was born out of the Act 186 from 2022 housing pilots. All of those have come to fruition from the pilot work. And then we're working with housing trusts and fundraising. Our providers have succeeded in opening several other DS settings that each have a different model. And the idea is to create enough and to create choice. Most of the residential care for developmental disabilities in this state are in shared living providers, which is about 30 years old since the initiation of that model. And there's lots of reasons why that model is waning and we need to have alternatives.
Are there any components in section 3 I'm talking about that address vocational transportation issues? Is it all about housing? Like rides to work?
So this is, this particular section is about housing.
How strictly housing? Is there anything in any area that addresses that?
Any area of the work that we do that addresses transportation. First of all, it's getting to work or getting to a doctor's appointment or depending on where people live and whether there's public transportation, whether the public transportation is something they can reach even if it's down the block from them is a problem. Okay, so I don't know if you want to say anything more about transportation and the work that we're doing.
Sure, I do.
We're on developmental disabilities,
okay.
So I'm pointing to.
We can wait till you get.
This is our director of developmental disabilities.
So transportation to support people getting to their employment is an allowable part of developmental disability services. It's built into the rate for the hourly reimbursement for an agency, so that is part of it. Certainly, as Dr. Bowen has said, transportation as a whole in Vermont is pretty challenging. We have had some early conversations with our Medicaid policy team about how we might be able to build out benefits within our DS home and community-based services as we renew our 1115 agreement. Also within our system of care plan, the issue of transportation is one of our special initiatives. So as soon as we get a little bit more stability under the major changes that we've made with conflict of interest mitigation and our renewed payment model, we will be starting a work group with our key partners to explore models. Other states have some really interesting Medicaid reimbursed transportation alternatives, and we want to explore what they're doing and see if there might be a world where we can bring those to Vermont.
Now, when it comes to, because you asked about employment, right? In the vocational rehabilitation for those with developmental disabilities and other disabilities, there are some opportunities, not sufficient for all, and it limits where people can get employment if they don't have the means to travel.
Right.
So in rural areas, you're going to see that. When it comes to older Vermonters, now I'm pointing at you, just getting to, let's say, a senior center where maybe there would be a congregate meal or an opportunity to engage with other people can be a challenge. There are a few who have some transportation built in, but not most of them. And people tend to drive to get there, so that means not everybody can get there. And just in general, the public infrastructure obviously is not there for everybody. There are some work in the rural health transformation plan to try to help address some approaches to reaching people or for transportation infrastructure, so that, you know, you can get a briefing on that. Did you want to say any more, or that was basically it?
Yeah, I think that in the older Vermonter space, it heavily relies on volunteers throughout the state to provide transportation.
Yeah, and a shout out to the volunteers, because many of them are actually older Vermonters themselves. Many are retired. The Meals on Wheels program completely depends on the volunteer workforce, but in other sectors too, we rely on volunteer workers.
Thanks.
Yeah. Okay, so page 6.
Senator Norris?
I'm sorry, before we go to page 6, I'm just curious, you said NCSS, just open up Abel's house? What?
Able House.
Where is that? What township's that in?
It's, yes, it's,
It's right in St. Albans,
Oh,
but,
yeah.
I think it's at 6 Home Health Circle, so right near the hospital.
Okay, thank you.
that's since we were talking about the intersection between older Vermonters and disabilities, this program was built for people who are older, like 40.
I think you have to
40.
be 45.
Yeah, you have to be at least 45 to qualify, because for these folks with development of disabilities. You're not there yet? Are you not there yet?
Not quite.
Oh my goodness, well, sorry.
Don't rush
Something
it.
to look forward to.
Yes.
So this is a forever home for them then, because they can age there, and that was built intentionally. And so they're set up to be able to address some of the issues that could arise just in the normal aging or in the complexities that we see across the board.
Is it allowed in Vermont? I know in other states where residential, because this is only 6 beds, could somebody open one of these in their home and have it like 3 beds?
So there are, there's a couple of different approaches. The issue I said before with most being like SLPs, which is shared living providers. So the majority of the folks who are in residential in the DS world are in a shared living provider. That means somebody has invited them into their home. They do get compensated for that, and it could be, usually it's 1 or 2 people. When you hit 3 in Vermont, there's a need to talk about licensing. Okay, so the therapeutic TCR, community residence, there's some of those out there too, depending on what the type of program it is. And at 3, you would need to be licensed. So yes, there are programs like that. Many of the models, the sort of independent or peer models or that are being built now are looking for that kind of community peer connection that hasn't been as available to this population. And so some of the innovative ones that were built off of Act 186 are like that. But we're not talking about large numbers, and that's one of the challenges. Act 69 will show you that we need space for 600 people. So that's a big leap. It's a big lift from where we are. But if you have a mixture of choice and mixture of, let's say, intensity for what the needs might be, that's the vision. Okay, we're not there now. So when these open up and they're small, and each one, they're celebrated. I've been to all of them to take a look at it and to talk to the people who are being served there. You walk in and it feels like a home. Yeah. It is really special, and people are really happy to be there. Okay, so let's move on from there. We're going to the next page for a quick look at the Direct Care Workforce Initiative. It's over here. Do you want to speak to this since you've been very directly involved?
Sure. We're doing a few things in the direct care workforce space, recognizing that's the backbone of our HCBS system and our nursing home system as well. So in 2025, we applied to participate in the National Direct Care Workforce Strategy Center Collaborative. And through that work, we're partnering with other states on learning, and we're getting technical assistance from national experts to really focus on supporting our independent direct care workforce as well. We have thousands of Vermonters who self-direct their care and hire their own caregivers to support them. Those individuals we don't have any requirements around training or education. So we're working on creating a core competency model for those workers to then be able to work on training for them. We also implemented a marketing campaign in 2025 called Careers in Caring, which was really successful. It was, radio, TV, social media, and drove people to our Career in Caring webpage, which then directed them to learn more about the opportunities and the different agencies where they could find work. So we had over 120,000 visits to the Career in Caring webpage during that campaign. We're also working on an RFP for a direct care worker registry. So for folks who are looking for caregivers and for people who are looking to provide care, they can go to this website and basically be matched, find a good match and a caregiver to support themselves or their family. And so we're hoping to have that developed this year. And then, of course, we worked closely with the Vermont Healthcare Association and the nursing homes to implement the grants for the LNA workforce that were appropriated last year for recruitment and retention of LNAs in nursing homes. And over 17 nursing homes took advantage of those grants this year to implement projects related to training, scholarships, mentorships, supervision, et cetera. And that's had a real impact in our nursing homes in helping retain LNAs.
And I was in the room when AHS did their presentation, so you learned, you have heard a lot about the Rural Health Transformation Plan, but we are the lead for two of the initiatives, and one is an LNA workforce initiative that will, and the NOFO is going up. I think I was in here once when you did a fist bump on that. Yeah, you did a fist bump on that.
Yes, we did.
You gave us the grants that were successful. Next step in the evolution is creating basically a hub. So coordinate the trainings and the opportunities across the state and help folks get into those positions and support their success. The other one, just as an FYI, is the complexity of the nursing home, increasing ventilation and dialysis. So those are not in our budget. I'm telling you that because we are the lead on those and it's part of AHS's efforts around rural health transformation, but it did come from the LNA piece of it was encouraged. We were encouraged by what the results of that was. Okay, so.
And you should probably tell the committee that how much you've asked for.
From the rural health transformation, it's somewhere around 800,000 for
11,000 per year for 5 years.
And
yeah, but it could be more.
We had put in.
Yeah. Great. Again, this is that's year one, and we have you heard the whole, like, we have to be able to get it out the door and prove that we've done what we said we would and have outcomes, whatever, in order to get it to year two. So we're anticipating being able to do that for 5 years and having an infrastructure then that will work.
The only reason, it partly is it's been hard for us to figure out what's in that grant and what's not.
Okay.
In the federal grant,
that's for that particular initiative.
No, for everything.
No, I can tell you what I know.
You just fit it for everything. It's been a little hard.
Okay. Not everything is all locked down yet either.
You've got it all
Well,
now,
I don't have it all, but,
'Cause this
but it
still,
hasn't been that easy.
no, it's not easy at all. And, yeah, it isn't easy, but it's moving. That's the thing.
Yes,
yeah, and there's a lot of information online, but some of it is not locked yet. There's still negotiation
Yep.
going on, which is why the 811,
Yeah,
whatever,
yeah,
yeah,
we-
okay.
but it's just,
Okay, the next thing on page 7 I wanted to, talk with you about is, the Pathways to Partnership grant, which is still ongoing, and, that is led by, DBBI, and it includes coordination across the school system, to create stronger transitional plans for students with disabilities. It's basically partnerships between schools and community agencies. 6 on here is the hireability opioid recovery employment pilot. You will see that as essentially our one initiative. While it's not new, it's been in pilot phase and it has been funded by the opioid settlement agreement. It is now coming into phase. It is one of the most effective programs that we have and it's in 3 editions started in, let's see, it started in Orleans at Chittenden, and it's working to expand to Rutland and Bennington. And since November of 25, which is not that long ago, they've generated over 542 referrals, 317 applied for services, 94 placed in employment. These are people in recovery from opioid use disorder. And this is an effective approach because those who are employed, the employment itself supports their recovery. And those who are in recovery, the recovery supports the employment. So this is a good program and it's working well, and you'll see that that's in our budget.
Is there something in your budget about the career advancement project, which seems related, ending? Does that make sense?
Career
The Vermont Career Advancement Project.
That doesn't sound familiar to me. Anybody? That's in, you're saying that's in our budget?
Yeah.
What is that?
NBR.
Oh, you're talking about hireability. I'm sorry.
Yeah.
Yes, so hireability has many programs, but one of them is really focused on careers. So helping people get credentialed or diplomas or skills so that they can advance in a career. So not just to think about a job, but to think about a career. And there are testimonials that are, give you chills.
But that's similar to what the opioid employment pilot that you're talking about, turning into the base, or it's a different population?
It's a completely different population. One is a substance use disorder population, that's the opioid recovery, and the other is folks with disabilities.
So you need 2 different types of counselors and folks working with
Absolutely, different skill sets.
individual cohorts, yeah.
Yeah, different skill sets, different cohorts, yeah. But ultimately, your point about the importance of employment and success for people facing any number of challenges is, it's underappreciated as a real great tool for success and for people's well-being and sense of confidence. Okay. So let's see, we're up to page 9. The bottom of 8, I just wanted to call out Mission Care at Bennington. So that has now been in place for a little over a year. And they have met their contractual obligations. They're at 90% capacity. They have brought in folks with complex care needs. There are some other nursing homes or SNFs who do take people with complex care needs, but this is their entire sort of approach, is to bring folks in with complex care needs. And they have admitted more than 60 new residents since they opened and have helped to reduce the boarding at hospitals and emergency rooms. Okay, the next, on page 9, number 9 is nursing facility stabilization and sustainability. And this is an approach we are taking to address the fragility in the nursing home system and the capacity challenge in our nursing home system. There are, well, technically, I guess there are still 33 because it's supposed to close in April, but there's no one there anymore. So that we have lost Green Mountain Nursing Home, they closed, and the individuals have been transferred to other settings. But we are at risk for others closing. There is just a tremendous amount of fragility at a time when the demographic is increasing. So we have looked forward and said we need to be planning forward. Now we have 5 different areas of focus, that not the least of which is the workforce, but there are others like infrastructure and the ability to bring in complex care cases, et cetera. And we have focus areas, and we're on it. We have gone from planning into stakeholder engagement, and we have our kickoff engagement meeting tomorrow.
And similar to my question before, can there be like a small home-based nursing home?
So we have residential care homes and assisted living facilities that can meet an ERC level that can provide nursing home level of care. We also have Money Follows the Person, which is a federal grant that helps people to shift from a nursing home or some other institution like a hospital setting into a different kind of community setting, could be their home, and bring over the services there. So we definitely have alternatives.
So people can do that, make it like a home-like setting where they might only have 2 people there, 3.
Well, the residential care homes and assisted living facilities tend to have an adult family.
Right.
Oh, adult family care would be that, what you're talking about.
2 choices for care you do.
It's all choices for care, but usually an assisted living facility or a residential care home have more. But
Right, non-licensed, adult family care homes can serve up to 2 people who are, yeah.
Did you introduce
And they all,
yourself for the record?
earlier I did,
Okay, good.
yeah. I can say it again, for the record, Angela McMahon, the Adult Services Division Director for Dale. So in Choices for Care, we have many people who are at nursing home level of care. That's one of the clinical eligibility for the program is that you need nursing home level of care. So we have many people who are served in different settings. So some of them are adult family care, some might be in their own home or in their family's home. So it's nursing home level of care in the community.
Yeah, in our sustainability planning, we need the entire care continuum, long-term care continuum. It's not just about nursing home. We need all of it. It's not either or, it's both. And there's fragility in the long-term care as well. Although they did get rate increases that have stabilized them a little bit. Last year, we added more residential care home beds than we lost, which was a net positive for the first time in a few years, right? So we're working on that.
Good.
Okay, so next slide is number 10. So the APS statute has been, I think, ready for its 3rd reading, or it had that?
We had its first reading yesterday, and passed the House. So we will all be hearing a little bit about that soon.
Yeah, so this came about because CMS changed its rules, and one of the areas that needed to be adjusted was caregiver negligence, and there were some challenges in past years in terms of balancing the needs of the individual who's under their care to assure their safety and supporting the workforce, because caregiver workforce is, it's very difficult, work. And so balancing that, what we did was we came together with a wide array of stakeholders across the board, in law and in, direct care and like advocates and like everybody. And we had 15 sessions throughout the year facilitated, and we agreed we were gonna work towards a solution that would allow us to be respectful for the caregivers, ensure the safety of the individuals, and be in compliance with CMS. And we came to consensus, and it's, we're in agreement.
Good.
And we, you know, this is it, this is going to, it looks like it's going to make it through. I'm gonna knock on wood. It's going smoothly. Okay, let's go to, page 17. Here we have a slide. Can you pull it up just a little so you can see the picture? This goes back to the choices for care settings so that you can see adult family care, which you asked about, Senator. Enhanced residential care, which is one of the, that's the residential care homes at the enhanced rates. The home and community-based services moderate needs. This is the whole choices for care continuum. A nursing facility and traditional home and community services. So you can see in blue is 2025 and green is 2024. You can see where there was growth in the community-based setting, and you can see the nursing facility utilization growing. So you can see that in adult family care and in traditional, the top and the bottom, you pretty much see steady. But for enhanced residential care, the moderate needs and nursing facilities, again, community and the more acute, you're seeing growth. So that's why we need a stabilization, sustainability plan, because we need to have the capacity and we need to have the stability. Next is just so you can see the highest enrollment counts. These are for those who meet the criteria for high. And you can see home and community-based versus nursing homes. So we for sure each year have more
Not
people.
the next slide after that.
No, next slide, please. Yeah. Page 18. There we go. Okay, so what you can see here is that there are more people in the community-based settings receiving the highest services than in the nursing home setting, but you're still seeing increases. Just wanted you to see that. And then all of it is interesting. I'm just trying to pop for you because, you know, below that is this adult day program for the brain injury program and the OAA home delivered meals and, you know, et cetera. There's a whole continuum there that needs our support. Okay, so we're gonna jump to 26. And this is just, now we're in developmental disabilities, home and community-based services, so we can see the growth in the utilization pressures here. So we have about 3,400 people being served through the developmental disability services, home and community-based services population. It's 3,394 people. There's over 1,000 served by flexible family funding. There's nearly 650 in family managed respite, over 460 in the bridge program, more than 750 in the Office of Public Guardian, Public Guardianship Services, and then a little over 300 in the Office of Public Guardian's Representative Payee Services, or FPA. So just so that you can see for the population, what's happening longitudinally over time. Okay, now we can look at slide 34 or page 34, please, just so that you can see what you're looking at here is, for the blind and visually impaired work, compared to the nation, the MSG in the bottom is measurable skill gains. And you can see that, look at 25, which is, you know, each one of them are comparing to the nation. But if you look at all the way on the right, that's our most current. And we exceed the nation's results. And I'll show you that for higher ability too on page 46, because that is also exceeding the nation's in median earnings, in credential rates, to your point about credentialing and career building, and in measurable skill gains, we exceed the national average. Yeah, yeah.
So.
That's great.
So,
Oh,
no,
you're, I'm not sure if this is quite the place to ask, but I think this is blind and visually impaired.
Go ahead.
There's an elimination of the Vermont, support services provider in, this area, is that correct?
That's, it's not an elimination. It was never in the base. It's, over the last year or two, I believe, we've been able to fund it through FMAP and other, fundings. We looked to see whether it was a billable service, and unfortunately it was not. So now and we stretched that as far as we could go, so we're good for this year, but it's not in our budget. It was never in our base budget. We've always kind of been able, at least the last few years, to cobble together. It's a small number of people served who are both.
Can you, talk to the committee about the service? Because we've had, when we, had our hearing and we had people speak, it got brought up a few times and we've heard about it. So, can you
I mean,
speak about the service?
it's not that it's not a good program, right? It has, people who are both, deaf and blind, and it's a support program for them so that they have somebody who's actually with them, like physically with them, to help them navigate, whether it's community or in some cases it could be a work environment, but for many of them it gives them more freedom, more ability to be more present in the world. So people feel very strongly about it, but it is not in the budget, and it's not an elimination, it's the end of the FMAP.
And can you just tell me how much if we put into that?
We're at,
Yeah, 115,000 is the annual.
I think it was 60 for the half year, so it's about 120. Is that what you, yeah, that's good.
Okay.
Okay, let's move on to 48. We can go into what you've all handed out. I do have mine right here. This looks like something. Yeah. So to look at the top, can you come down so that everybody can see? Well, they have it in front of them, but above that. Yeah, there we go. So our total proposed budget for fiscal year 27 is $829,747,105. Broken down by funding source. General fund is 4.7% of that. Global commitment is 88.2%. We are very heavily Medicaid funded.
So do you have in here what that is as a percentage from last year?
That's a percentage of what's being proposed, 829.
Yeah, no, the 829 million compared
Oh,
to
yeah, we're
fiscal
gonna
year
do a whole,
26.
we're gonna, the next page is the
Does it have it
breakdown.
at the bottom?
No, next page. Oh, what's that? Yeah, you have it in your little thing.
Is there a percentage? I don't see a percentage.
Okay.
What was your percent? Did you meet the governor's 3%, for example?
Oh, do you have that?
I think it's around 3. I can calculate it.
Yes.
Put around 3, we're close.
We have the last year's and we have this year's, so you could do math. He's the CFO, you can, okay. So the federal fund is 6.5% and, special and interdepartmental fund is less than 1%. So now what we're doing is breaking it down for you by our divisions. So the developmental disabilities, 367,828,199, that's 44% of Dale's total budget right there, and 97% of that is global commitment. Next, the adult services division, that's our largest, which it didn't used to be, but with the cost of nursing homes it is. It's 403,614,407, and that's 49% of Dale's budget, and 93% of which is global commitment. For a vocational rehabilitation, which is higher ability, it's just under 36 million. That's 4% of our total budget. 24% is general fund, which is kind of the match to the federal, because this is very directly funded by the federal government, 76% of it.
3.93%.
3.39?
3.93. Good job. And then the blind and visually impaired, it's 5.8 million, which is approximately 1% of our budget. General fund is 21%, and they're also, as the vocational rehabilitation, heavily funded by the federal government at 74%. Licensing and protection is just under 8 million, approximately 1%. 55% general fund and 45% federal. Commissioner's office, 8.5 million, approximately 1%, 85% general fund with 14% federal. And that brings me back to the 829,747,105. The next is where we will compare to last year's. So the total change is 31,346,555. By the way, that's 3.93. Okay, so in 26 for administration, we had 55,517,792. The proposed changes is an increase of 5.8 million. You can see the split of general fund, special fund, the IDPT fund, and the federal fund. And that's how we get to, 2.48 here, where it comes to 5.8. So what's recommended is an increase of 61,380. What's recommended here is 61,383,402 for administration and support. For the adult services division grants, in 2026, the base appropriation was 24,909,492. The proposed changes, so we have an underutilization of adult day, and therefore pulled $1 million back in from that budget. They still have money in their budget to expand. So this is an efficiency in lieu of any cut that we wouldn't want to make, since they are lower in their use than they have been in the past. Not that they're not working to increase their participation. And
that's one of the areas that we didn't get to cover when we sat down because we had so little time. I will need to hear from you about where we are with that. I know there was someone in Washington County last year that was interested in opening, and during COVID, we had at least 2, maybe 3 closures, and we aren't back to where we were.
We're not back, not just with the ones that closed. So I believe one of them opened. Is that correct? Of those 3?
No.
None of them opened?
No, there is a project plan for Washington County.
Yeah.
I believe that they've secured a location.
Yep,
But we're still talking about several years to build, and
Yeah.
Hope Bend is the intergenerational facility. And we've had some interest in the Rutland area, but very, very beginning stages
well,
of.
the people in the Barry area, at least 3 of them have been taking their elderly parents to Morrisville. So it's really kind of, so I will be interested, but we didn't get a chance to have.
But this is utilization, anyway, would you like to?
Yeah, I can share with the committee some historical utilization, just to give perspective on. So the base budget for this was 3.3 million. And in 23, the actual expenses were 1 million. In 24, 1.5 million. And in 25, 1.8 million. So take the million away, we got 2.3. There's still room for growth in utilization.
Okay,
So-
underline.
What's the biggest barrier? Is it just people, volunteers, transportation?
So,
Yeah.
I figured, you know, in talking with, in going to the sites and talking to
Yeah.
people, and you can see that there's fewer people. Not that there's nobody there, there are people using it and they need it. Has been just people not coming back after the pandemic. And either because they're not feeling comfortable or safe coming, there's still a lot of people who just did not return to this kind of social engagement, and support. Transportation is an issue, and like I said, in some of the centers, they actually do have, transportation, but, most of the people who come are driving or they're going with each other. And the programs remain excellent, and for many, it is, and many families, it's the difference between being able to remain employed, and it's, but the reality of the moment is that they're not using the amount of money that's been budgeted. Yeah, okay. You're good?
But I will have to have a discussion about that. One of the complaints that has been by the providers is you'll have, that the way the payment structure works, you have to show up every day to, get reimbursement. And the rolling average, what happens is somebody gets sick for a few days, they're not there, that the adult day doesn't get paid, and it racks their budget to be able to put it together on a basis. So we didn't get a chance to cover it, but that's one of the areas I'll want to get some comfort level in, and where we
Kind of a way of talking about no shows. Because they have capacity, they certainly can have more people come in if they can bring them in.
Well, if they call in the morning and say mom or dad is really sick and they can't be there, and they have to show to pay for that, and they don't show up, you know, yeah.
Yeah, it is a fee for service model, so you bill for the time that the individual is there. I don't know how much we want to talk about the rate study that was done several years ago.
Right.
So
I
those are
will
things-
when we're
yeah.
not here, but you know, there just is all of those issues around in that piece. And,
that is a fee for
and
service
and I totally get why you're taking the million out, but underneath all of this, you know, I would say, and I know we've been working with someone to do, but when there's not a single adult day here in Washington County, it's, it's difficult.
Yeah, so we do need a provider to step forward and say they want to put together a plan.
And we did have some money, in the years past to help with the opening of, adult days. Cause we, you know, we did lose the 3, and, and I'm not really sure, given this, if there's still what there is out there for people to help people start.
For startup.
Yeah, for start.
So those funds have been utilized by the proposed and the one that's in, Washington County.
Yeah.
So they did get a grant, and we have,
Yeah, I have no idea what's left, if
Yeah.
there's more, if, and what there is, because,
right,
So
yeah.
is that something we can get? Do we know the answer to that?
The answer is all of the funds have been distributed.
Okay, so there is an answer.
yeah,
Okay, great. So, you know, fee for service is a model that is the most common model when it comes to Medicaid, et cetera. And you know, even if you go to your primary care, it's gonna be, fee for service and, you know, and you're not gonna get,
are there 13 left in the state, adult days?
11? I think it's
11.
11.
thank you. And thank you for the interest in it. They are an important part of the continuum.
They certainly are for families that are working and, yes.
Agreed. Okay, but that's why we took it from there as opposed to, somewhere else.
Sorry.
I'm just gonna keep going or?
Yep,
Yeah.
keep going.
Okay, so the federal revenue reconciliation at 0 is something you wanna explain that, just move from one to the
Yeah,
other? Yeah,
if you have the ups and downs in front of you, and if you don't, it's fine too. There was a transition between getting some general fund from central office, and they utilized some of our federal in a different place in the agency, net neutral.
yeah. And budget to actuals adjustment at, 3,350,000, which takes under the adult services division grants, takes us to, total changes of netting 2,350,782. So the state fiscal year 27 recommend for this, for the adult services division is 27,260,274. Then we can go into blind and visually impaired, the grants. In 2026, it was 3,407,604. There were no proposed changes, so it remains at that rate. Vocational Rehabilitation Division, which is hireability, last year was at 10,179,845. The budget to actuals is into departmental transfer funds. Do you wanna explain 1 and 2?
So anytime you see a budget taxes adjustment for a particular fund, and I'll just mention federal specifically, because there's so much interest at the federal level. Whether that reconciliation is up or down, it doesn't mean that we got more federal or less federal funds. It's a utilization adjustment and to the spending authority needed in that appropriation.
Okay, and then the opioid recovery employment program, which I had spoken with you about before, gets us to the recommends, the change is 840,539, and that gets us to 11 million and change for hireability. The next page, we're at developmental services grants appropriation. In 2026, it was just under 350 million. The proposed changes is caseload. So it's additional 6,604,679. And then Public Safety Act 248 caseload is 3,344,342. Those are both caseload utilization pressures.
What is the Public Safety Act 248?
So there's 2 separate things. Act 248 is for folks who are, have intellectual disabilities and are charged with a crime, and are found not fit to proceed. There are particular crimes that tend to be included in this. And then they are determined to be committed to the commissioner's custody. And we have about 30 in the state, and it's basically a community commitment. So there's monitoring and oversight and living situations that are provided, and a whole array of supports and services to help them to get to a place where they can function independently. That sometimes takes some time, sometimes it happens more quickly. Most of the folks there, this is successful, but there's a few for whom that's a particularly challenging program. The designated and specialized services agencies provide the supports and the monitoring, the supervision and the monitoring.
And the increase, the 3.3 million increase for that, just increased participation.
Well, it's that plus public safety. So public safety is for folks who have not been found to be not fit to proceed, they're not committed to, but they're on our rolls and they present as a public safety risk. And so that requires a different type of approach often for those individuals. And yes, there's more folks than there used to be.
I could give a little bit. So the caseload's calculated by a 3-year average, and it's generally split between additional needs for current customers and new consumers in the program. If that helps answer your question.
Yeah.
So are we dealing with competency issues
For Act
or,
248, we're
for Act
dealing with
248?
competency.
but not insanity issues, just competency issues?
Yeah, because they are essentially released or committed to the custody commissioner, so they are not still having their case adjudicated or being determined whether they're not guilty by reason of insanity. This is all just about competency, and then they're not in the system at that point. They're not in the criminal justice system at that point. They're in
They're near system.
Yeah, and it's an issue that we worked on in our committee last session.
Some time now.
I'm seeing, it's
Okay.
not,
We can
it's
move on.
complicated.
right, and it does have costs associated with it, as you can see. Internal service fund, that's the commercial.
It's under $10,000, you know what I mean?
Okay, great. So the IRS payroll benefit withholding exempt reduction is money that was at the financial intermediary for benefits, and over time it had built up enough that we were able to pull back. Anything you would add to
Unless there's
that? Okay. And budget to actuals we're not under 10,000, but we're under 20,000. It's just
Yeah, things like that are okay.
and then the federal fund budget to actual adjustments, that was as was explained, but in this case it was less. The ARCH program ended and the funds were returned to Dale. This is AHS net neutral with DMH. Integrating family services ended and the funds were returned to Dale. That's the increase in that funding. And integrating family services ended, funds returned to DCF. And then on deposit with Dale, so that's 200,000. So for the total changes for the developmental services grant appropriation, it's an increase of almost 8,200,000. You can see the fund splits, and that brings our state fiscal year 2027 recommended for developmental services grant to just over 358 million. The brain injury program has no changes from state fiscal year 26. It's still at 7.5 million. Now choices.
And it's just level funded. Are you seeing less need for that with all the work we've done on trying to do TBI prevention paying off, or is it just something else? Like,
Do you want to take that?
I don't think that we have data to make that correlation. I think that caseload pressure is something that we assess throughout the year. We now have case management organizations that cover statewide. So with having those case management agencies, we may actually see higher utilization of services because we're connecting more people to services.
this was also part of conflict-free case management, that the brain injury program needed to come in for compliance also.
So the reason that there isn't an increase in 27, currently, we have funding for 91 or 2 consumers, and it's at 76. So there's room to increase utilization there.
Okay.
Okay, thank you, Bill. Choices for care, okay, so in 2026, the base appropriation was 346,858,094. The statutory nursing home inflation increase was 5,471,782. The nursing home Medicaid bed day pressures is 9,625,625, and you can see it's the days at approximately 362 per day.
And I could add that that particular line item you saw in BA.
Yeah.
So it related to 5 nursing homes from having a billing error and being paid this year and needing that BA request. This is putting that in the base budget because we didn't have the funding if that had been paid in the proper year.
Right. It was a billing error, but it was because they were using more beds.
No, yeah, but what happened there in terms, it wasn't really a billing error, I think it was a coding issue when they came in.
But the bed pressure is real.
Yes.
Yes, the bed pressure is real.
And are you thinking that's gonna change? Is this like it's gonna increase? We're not gonna see less bed days next year.
I don't think so, no.
So.
Maybe we'll see the same, but it wouldn't surprise us if it went up.
Given the aging population, we would expect this to increase similar, I would think, every year.
It might.
Over the next 5 years.
Over the next 10 years. I think it's gonna keep going.
Well, we have one less nursing home too.
You know, I absolutely thought about that, because we are at a slightly higher, we usually are between 80 and 90% capacity of late, right? And we hit 90, but I think that's exactly why, is because people were moved from Green Mountain to other facilities where there were beds available. So that, we can't afford to lose any more nursing homes or any beds, right? We need to add them. Like I said, it was really great that the residential care homes, because it's a whole continuum that can provide care. Any of the settings that can provide care for people who need nursing home level of care needs to be nurtured.
Okay. Yeah.
That brings up a whole other question. How would we add nursing homes?
Yeah, how would we add nursing homes?
How
Okay,
would we
so-
add, I mean, because we've only lost, when was the last time a nursing home was open?
Well, Mission Care opened.
I don't
but
mean
it was
to,
part of-
and
you're
that,
talking about
this is
building.
probably not the place to have that
Well,
conversation.
of course, because we're doing the stabilization, sustainability, we are absolutely looking at that. So, yeah, of course, you could build, not an easy thing to do. You'd have to find an appropriate facility. One of the reasons Green Mountain needed to close is because the structure of the place was an old military hospital, I believe, and it was bomb resistant, which means you could do nothing with the walls. And it was also set up with little corners everywhere, so you need twice as much staff to oversee a place like that. So we need facilities that can, either we build or we refurbish, or we expand where we already have nursing homes. We expand units, we expand wings, which is something that we've been looking closely at. And we utilize all of our available beds but you need to make sure that you always have room for churn and room for short-term rehab. So.
Sorry.
No, but that's the right, these are the right questions.
We don't really do long-term budgeting or nothing that we should be thinking about this increase.
Yep. I think by next year we will have some more concrete plans to talk with you about, since we are just starting engagement now. We have a very clear, project plan for the engagement, who we're engaging, how we're engaging, and by when we will engage it. But once we're done there, we're gonna be, getting into the next phase, which is, the actual, planning of steps that would need to be done to increase the capacity in the system. Okay, so, we were down to home and community-based caseload pressure. That's number 3 under the choices of care, a little over $1 million. It's the same hours payroll issue. It's just under the choices for care. And so it's an increase of 14.1 million at 300, just under 361 million. So that is our plan. I do want to take you, can you go to page 53? I do want to share this with you because I think it could be useful either when you're still have questions or you're budgeting, or, it's good reading on the beach when we get there. This is the data that's been submitted. It tells you for each program who is served, so it tells you something about the program. It gives you some performance measures about who's being served and any outcomes that we have there. In this first one is a survey, and then it tells you what is proposed in this budget specifically for the program. So you will see program by program here what the proposed budget is in the Dale's budget. So it takes it that next level down, and it explains what those programs are. So the next several pages, taking you from 53 all the way to sort of 69, 70, those are our programs.
That's helpful, yeah, I hadn't seen that.
Really. The appendix is just details on the LNA recruitment and retention grants for your, if you want specific information of the different, that might be Senator Westman and Senator Lyons. You might be interested to see exactly what that, yeah.
Very good.
Yeah, okay. Well, thank you.
That's our budget.
I will come back around. There will be some questions about Meals on Wheels.
Okay. Happy to answer.
Yeah.
All right, so we'll look forward to that. Is there any other questions, or we
Not
went
that I
through
have.
it and by asking questions through it, right?
Yeah, I don't think we have any questions, so thank you for this presentation.
Thank you.
I like Meals on Wheels too.
Okay, we'll look for those, Senator Westman.
I'll be back in touch.
Thank you.
So committee, we're not gonna do 219. We lost Senator Watson. And I also had a question on the amendment that we had in, our ledge council wasn't available right now, so we're gonna try to do 219 and the child care bill tomorrow.
Cool. Tomorrow,
If we can.
if we get off.
She sent another amendment? I just read that.
But that, yeah, the amendment that she sent was all, but then there was 2 questions that I had. One, there's 2 appropriations.
Yeah.
The second appropriation of the $10,000 to the
Thank you.
for the group in Addison County.
Mhm.
Her amendment doesn't deal with that appropriation.
Didn't she say something about if in fact they hire a project, the money's?
Right, so there's section 1A, is the department has to hire, or would add onto their consultant, hire a consultant to do the work. And then there was B, $10,000 for the Addison County climate, whatever it is. So our amendment doesn't, the one that Ellen drafted didn't talk about the $10,000. Right. So we would still go through it. And there's 2 problems. One, we can't give money directly to a just a group, right? We don't do it. I mean, I guess we could do it.
So we can find who to run it through.
So we'd run it through the Department of Public Service because they're supposed to talk to the department. But I wanted to take that appropriation out too. So I missed that when I read it last night, when I said it was fine. But
I read it last night, then I see she come out with another one today.
yeah, she adjusted the wording a little bit. So the first part, like the 2 other parts that you had talked about yesterday, I thought those were good, changing those. And then she her amendment says that their duty to hire a consultant to do the Energy Navigator report is contingent upon the appropriations.
Right.
But we should also say that about B. We should also say that it would be the department that would give them the money.
Mm-hmm.
Say they're only required to give them the money if we give them the money.
Right.
That makes sense. So,
So you're thinking about a further amendment,
To the amendment.
to the amendment?
yes, so
As
I
represented.
sent, Ellen wasn't available. I did send her an email. I said, I think we need another amendment.
Okay,
So we'll do it tomorrow.
great.
Sounds good.